How do genetic markers refine breast cancer staging? Imagine trying to understand a complex puzzle with only part of the picture. Traditional breast cancer staging has focused on the tumor size, whether it has spread to lymph nodes, and if it has metastasized. This system, called the TNM system, helps doctors determine how advanced the cancer is. But now, with advances in genetics and molecular biology, we can add more pieces to this puzzle. Genetic markers help refine staging by giving us a deeper understanding of how the tumor behaves and how it might respond to treatment. The 8th edition of the American Joint Committee on Cancer Staging System combines the traditional TNM approach with information about the tumor's biology. This includes hormone receptor status, which tells us if the cancer cells have receptors for hormones like estrogen and progesterone. It also considers the presence of HER2, a protein that can promote cancer growth. The tumor grade, which describes how abnormal the cancer cells look under a microscope, is also included. By integrating these biomarkers, doctors can create a prognostic stage that better reflects the tumor's true nature. For example, a tumor that is estrogen receptor positive and HER2 negative generally has a better outlook and might be downstaged compared to a triple negative tumor, which lacks all three markers and tends to be more aggressive. In addition, multigene panels like Oncotype DX, MammaPrint, and EndoPredict analyze the activity of many genes within the tumor. These tests generate a recurrence score or risk category that helps predict the chance of cancer coming back. Even if two tumors look similar in size and spread, their genetic profiles can reveal differences in aggressiveness. For instance, a small, early-stage tumor with a very low recurrence score might be classified as lower risk, which can influence decisions about whether to recommend chemotherapy or hormone therapy. Genetic markers also provide valuable information about how likely the cancer is to respond to specific treatments. Tumors with high hormone receptor expression often respond well to hormone therapy, which can be factored into the staging process. This helps personalize treatment plans, ensuring patients receive the most effective therapies based on their tumor's biology. Furthermore, genetic profiling allows clinicians to distinguish between tumors that appear similar based on traditional measures but have different outcomes. This helps prevent overtreatment of low-risk cancers and ensures that high-risk cancers receive more aggressive therapy. As a result, patients benefit from more tailored treatment strategies that improve their chances of successful outcomes. In summary, genetic markers add a new layer of detail to breast cancer staging. They help describe not just how the cancer has spread but also how aggressive it is and how it might behave in the future. This combined approach leads to more accurate prognosis and personalized treatment plans. Remember, these markers are used alongside traditional assessments, and your healthcare team will interpret them in the context of your overall health and specific cancer characteristics. Always consult with your medical professionals to understand what these findings mean for your care.